let's talk about Kegels.
Mm-hmm.
Kegels are everywhere on the internet right now. It's kind of the cure-all to everything, it seems. I see, for those of you listening, she just like did a gesture of like, oh, disappointment, put her head down. But I see them everywhere, like Kegels for this, Kegels for that. Kegels will improve everything about your sex life. So I'm going to ask you, is it possible to do too many Kegels?
So Kegels, I have a love-hate relationship with them, and Kegels are pelvic floor contractions, right? They may be appropriate for some situations, like if there's true weakness, right? And then they may be appropriate. But if you're dealing with pain or premature ejaculation, not helpful in the beginning. Though we do want to get to intentional and purposeful coordination and like motor control and exercises, certainly. We don't just not do those things because it's not functional. Like the muscles around the base of the penis, their job is to squeeze and relax to help with, ejaculation. They also help with maintaining an erection and rigidity. So, we need to get back to function. So, but initially Kegels might not be the thing for you, right? There is no number as far as how many are too many. There isn't. It really depends on how quickly this activity and how much is being introduced, and can your body handle the tissue demands being placed on it and adapt over time? What happens is people do too much, too soon, too fast. And that's like with any exercise, right? Yeah.
And then they get tight.
And then you get, and then, so you get tight, or they're just focusing on the squeeze and not being conscientious about the letting go, because in order for you to open a lid or open the door, you have to open your hand, and then you use your hand to squeeze and turn. But you can't do that with your fist closed, so you have to let go to have an efficient contraction. So it's about the squeeze and also about the letting go, so coordination. So
you might not want to start off with a ton of Kegels if you're already tight in that region, sounds like.
Yeah. Right.
That's a huge thing. And I've heard from a lot of guys who they'll email me. They've never done any of my programs, and they just have read about Kegels or learned about them. And they've said, oh, Taylor, but I've been doing Kegels for 2 months, like all the time, and I'm still struggling with premature ejaculation. Why? Like, what's happening? And then I'll ask a couple other questions about the tightness in their pelvic floor. And they realize, oh, wow, I am like just totally just constricted in that region. And yeah, I like how you spoke to it. The relaxation is really important too.
So important. And I like to also plug this, if I may, about like tone or, hypertonicity of pelvic floor is an old term. So it's still circulating, but we've since moved away from saying hypertonic pelvic floor, because there's no neurological issue like having a stroke or a brain injury that would actually change tone from that perspective. We're starting to move towards overactive or non-relaxing pelvic muscles, which are driven by reflexes of the nervous system. So people will often come to me and say, my pelvic floor is really tight. And it's like, okay, I got to like stretch the muscle. I got to do this to the muscle. And it's like, well, what about everything else that's like, that's contributing to this like descending facilitation of this reflex of guarding. Yeah, that's right. Like, and again, it's like recognizing that it's not just it's not a muscle pathology that we're dealing with. It's a protective response in some way.
That's huge. And I think we live in such an active world. There's so much going on. So many of us work so much, and we're constantly stimulated by all these things, and we don't take time to just relax. And so that ends up, we have a massive, I think, tight ass syndrome in the world, and this is something that happens.
Yeah, it does. And, when someone does an assessment, for example, of the pelvic floor, we don't have gold standards of, what's too tight? Because we don't have what's normal. So I'd like to demystify this on your show here for once and for all, as far as, when somebody says, oh my gosh, I'm too tight. And again, trying to pathologize muscle, we don't have, we as clinicians, and I say we don't have a gold standard of measuring tightness. Like, there's no normal, there isn't. And what we feel on your body is subjective. So we can't really equate like muscle tightness equals pathology or dysfunction, because I have tight hamstrings and I can do yoga. In fact, I did it for a whole month of every day studying, doing my yoga teacher training. I didn't grow 5 inches and my legs didn't get longer. And in fact, everything's still the same. Everything's still the same. So there's neurophysiological adaptation processes that happen that like contribute to changes of how we feel in our body. And again, that ease, but that's really like, that's definitely a conversation for another time. But like your brain, it has a lot to do, and the context has a lot to do with how comfortable you feel in your body. And the more we resist something, or the more that something is scary or unknown or exciting, you know, then that's going to change obviously the motor output or the output response on many different levels. So
sounds like we all need to be breathing more deeply,
and
taking a pause. So maybe let's all take a deep breath right now. And relax your pelvic floor.
That's right. Let it go. Let it flow.